Okay. Um, okay, aloha everyone. It is 2 o'clock, or a little bit after 2 o'clock. My co-convener is still in session. The House talks a lot more than the Senate, so they're still in session. But he's going to come as soon as he can. But I thought since we go from 2 to 3, we will start. And I'm so pleased that we have the new Medicaid MedQuest director with us, Meredith. Um, Meredith is going to give us an update of both the federal and the state Medicaid. So Meredith Nichols, it's yours, and we will have time for questions and answers, and then we'll talk about legislation after we're done. So proceed, and you have to unmute yourself. Welcome, Meredith, and congratulations. She's our
Thank you very
remote
much.
person.
Thank you
Thank
so
you.
much for that. I appreciate it. Are you able to see my screen? Am I sharing
Not yet.
appropriately? Not yet. Let me try again. Let me know when you can see it.
Started, but no picture. Let me ask out. Alex, can you see what the problem is with Meredith sharing a screen? She's trying to.
If you're coming in.
We don't see it yet, Meredith.
Doug's, let me try to stop sharing and I will reshare.
Oh, it came on for a minute.
Okay, let me try one more time. Sorry for the delay, everybody.
It did work.
Can you see it now?
Not yet. It came on for an instant, you know. Okay, now we're on.
We're on. Okay, wonderful. Well, thank you, everybody. And thank you so much, Senator Moriwaki, for allowing me to come and share. I hope that this isn't too boring for people who may have seen this presentation before, but I wanted to make sure we're all at different levels of understanding maybe what has gone on and is going on, especially with regard, I have a particular focus on what's happening federally, and then I thought we could talk through what's happening at the state level. So we will get started. I always like to start with our vision for MedQuest, which is the people of Hawaii embrace health and wellness. Okay. And that our mission is to empower Hawaii's residents to improve and sustain well-being by developing, promoting, and administering innovative and high-quality healthcare programs with aloha. And I wanted to start by reminding us where we are. So the MedQuest program runs by a series of rules and policies. The basic thing, every state Medicaid program is different. And so states have a state plan that's unique to each state. And when we amend a state plan, sometimes it's called a SPA or a state plan amendment. And then we have a series of waivers that help us establish how we're going to do our work. So here we have successfully implemented something called an 1115 waiver. So it's a waiver from the way you typically would do things. And the thing about waivers is when you propose to do things in a new way, you have to make sure it's budget neutral. So you have to show like, hey, we want to do different work and we don't think it's going to add to the cost of the program. So the existing waivers were here. We have a waiver to do managed care and to do behavioral health and make sure people have access to good behavioral health, to do home and community-based services that support members who can then live safely in the community in the least restrictive setting of their choice, which we know is the most healthful option for people. And then community integration services. So that's providing eligible individuals with housing supports, pre-tenancy supports, and tenancy. And then what you see highlighted here are some of the expansions we've done beyond just what the waiver is. Like, for example, under home and community-based services, adding assisted living facilities to at-risk and also telehealth. And this is back when there was public health emergency flexibilities. I wanted to then take us to the newest set of 1115 waivers, where we really pushed at the envelope, and we were one of the last states to get an 1115 waiver through in January of last year, before CMS signaled that they wouldn't be entertaining 1115 waivers anymore. So it's an 1115 waiver for a 5-year period. It started in January of 2025. And some of the things that we applied for and received approval for were to have continuous Medicaid coverage for Keiki all the way from age 0, so newborns, all the way to age 6, meaning we don't have to renew their eligibility every year. If you're brand new and you're on Medicaid, you're going to be covered all the way through your 6th birthday. That kind of continuity of care is really important for a Keiki. And then after age 6, still continuous eligibility, but for 2 years at a time. So between 6 and 19 years old, you're continuously eligible 2 years at a time. We also added a new project called Nutritional Supports. For example, piloting things like fruit and vegetable prescription or protein boxes, knowing that food is also medicine, and really understanding how the Medicaid program might be able to help in that area. And this thing that you've probably heard of before, community integration services plus. So we added medical respite for pre-procedure and short-term and post-hospitalization stays that includes recuperative care. So if you think about, especially in our houseless community, for folks to be able to receive care, say you or I, who may have a house and we're having a colonoscopy coming up, and there's prep as you get ready for a colonoscopy. Well, if you don't have anywhere to live, you can imagine that prep would be really hard to do. So having a space, a medical respite space where somebody can go and do prep for surgery, and then also where somebody can go recover after surgery. So this is set up here, and there's all kinds of details around that program for medical respite. We also have expanded rental and utility assistance, including housing application costs, utility setup for up to 6 months of utility payments, and up to 6 months of rent over the demonstration period. So the green areas are the areas that we're focusing on first. And then with our justice-involved population, this is really important when people are exiting from being in prison or jail, making sure that they have access to good health care from the minute they step out the door. We know really helps with recidivism. It helps people stay healthy and be more successful on reentry. So the idea here is to start giving them good access to Medicaid covered services up to 90 days before they're released. All righty. So now I just want to take you briefly through MedQuest stats, what it looks like. Oh no, did my computer just shut off? Can you still see my screen? There we go. All right. This was just showing you the application volume, but I want to take you right away just to how many people are currently enrolled through MedQuest. So you'll see from this slide all the way on the right-hand side, as of Monday this week, we have 385,385 Hawaii residents being covered through MedQuest. That's come down since the height of the public health emergency, where we went up to about 468,000 individuals. We know that during COVID, a lot of people in our service industry lost jobs, lost their access to employer-sponsored coverage. And so we were happy to be able to cover people all the way through this 3-year uptick during the public health emergency. You can see before the public health emergency, before that, March 2020, when COVID came to our shores, we were pretty steadily covering about 327,000 lives. And then we really, really shot up. And so after the declaration of the public health emergency ended, we, and every state was ordered to start doing your renewals again. During this time, we weren't doing any renewals as directed by the feds. So we started doing our renewals. And like every state, you expect the enrollment to come down as people are employed. They have access to employer-sponsored coverage again. Some people moved out of state. So this initial year is where you see the sharpest decrease. The initial year that was called unwinding, or right after the public health emergency. And then after that, you see basically this stair stepping down. We go down and then new people come on, but overall a downward trend. But 3 years after the end of the COVID public health emergency, we're still not down to pre-COVID levels. So I think that's something important to take note of. Also want to demonstrate that county by county, this is what the enrollment looks like. So I know all of you have different counties that you're attached with, associated with. You have Ohana in. So the blue numbers you see tell you the total enrollment per county right now. The green numbers above it tell you at the peak of enrollment what the numbers were and how it increased. For example, Maui County during COVID, their enrollment increased by 48%. And then since then, it's come down by 17%. But in no county have we come all the way down to pre-COVID levels. And then this is just a summary chart using some averages, about 385,000 people, meaning about 27% of Hawaii's population. And that breaks down into about 46% of the MedQuest population would be considered non-disabled adults, or 178,000 people. That breaks down, and the reason the yellow highlight 126,000, that's an important number because the federal policies through HR 1, or some people call it OBA, those policy changes mostly impact this highlighted group. It's called the expansion adults. It doesn't, most of the changes don't impact the kids. So the keiki are not going to be impacted. Our parent caretaker relatives, folks who are in that group, are not going to be impacted. Folks in our aged, blind, or disabled. So that's where you're covered if you're over 65 or if you're blind or disabled. These impacts, for the most part, don't impact that population where we have 56,000 people covered. So what are some of those things going on? So the slide I like to open up with is not meant to, I'm not going to read everything across this slide. It's too much, but I just wanted to draw your attention to this red star, just to let you know this is where we are right now, and that it's going to be a long haul, right? So the implications start here, and we're just at the beginning where the red star is in the first quarter of 2026. Where we're going to start to see the first impacts will be in October, where we have changes to the definition of who a qualified immigrant is. And then the majority of the impacts we'll talk about start in January of 2027, and some start beyond that. Before we get started there, I do like to share the good news, which is as we look nationwide, Hawaii is fortunate enough to have one of the highest renewal rates in the nation. What that means is when it's time for people to renew, about 90% of individuals did have their coverage renewed in Hawaii in the past few years. That compares to only 79% nationwide. So we feel good about that number. It's a lot of work, but it's really important that people are able to have stable access to coverage. When their coverage is not renewed, it can be for many reasons. The good news reason is always when, hey, people make a little too much money now, they're no longer eligible, they're doing better, they're back at work. Many people are back on employer-sponsored coverage. Since we have the Prepaid Healthcare Act, that's a nice safety net for all of our people. Sometimes, though, people do lose coverage during renewals if we don't get their paperwork back in time. Maybe they never received their paperwork, and those are the stories we're trying to minimize. We're trying to do our utmost in partnership with everybody in community, like all of you, to be sure people are clear. When you get that pink notice, don't throw it away. Make sure you open it and, contact MedQuest so you can get your coverage renewed. All right, so back to HR 1. I signaled it a little bit starting in October, so October 1st of this year. The new rule changes the definition of a qualified alien, which means the following people will no longer have access to Medicaid. Refugees, humanitarian parolees, asylum grantees, certain spouses and children who are present here in the United States fleeing violence or abuse, and certain human trafficking victims. These are all of the categories of people who will be now considered no longer eligible for Medicaid effective October 1st. So we're doing our best now to review our system. We understand and estimate between 1,200 to 2,400 people who are currently covered by Medicaid could lose their coverage based on this change in definition. So that's 7 months away, and we're hard at work to try to figure out what levers exist that we can use. Maybe it's updating someone's status. Maybe what we have in the system shows they were an asylee, but maybe since then they've changed their immigration status. And so that's the work that we're undertaking right now to find that out. All right, the other change that's happening, and now the changes I'm going to talk about are all January 1st of 2027. Right now, people can get up to 90 days of retroactive coverage from the day that they apply. So this is really important for our hospitals, for our individuals. Sometimes people don't know that they lost their coverage until they show up at the doctor. And so then they start a new application. And right now, it can go 90 days retroactive. So this happens sometimes for Hapai moms. Maybe they weren't covered, they didn't realize it. They're at the hospital, they're giving birth, and then they work on their application. And the coverage can go back to cover any medical need they had within the last 90 days. For that low-income adult expansion population, that's going to change to only 1 month or 30 days retroactive coverage. The other categories like CHIP or Medicare, this should say, or our ABD covered folks, there will still be 2 months of coverage, retroactive coverage. So even that goes down to 2 months. But for that expansion population, which is the big target for most of these rules, it's only 1 month. The other big change, and this is a big change for us, for that expansion population only. So again, I want to be really clear. This is not for Kupuna covered in the ABD category. This is not for Keiki. This is just for that low-income adult expansion population. They're going to have to renew every 6 months now instead of once a year. That's going to be a really big deal, we anticipate. It's already difficult for people renewing annually, but this for that portion of the population, they will now and we will be required to renew their eligibility every 6 months. The other big news that you folks have probably heard about the most is this instituting and mandating worker community engagement requirements. Again, that's only for the expansion age people 19 to 64 who fall into that coverage expansion adult population. Health and Human Services is still due to issue their final rules so we can understand all the details. They gave themselves a deadline of June 1st of 2026 to get those rules out to all of the states. So we're still waiting to see what those rules will be. There is in the law the opportunity for a state to request, hey, could we get a little more time if we demonstrate we're doing a good faith effort to move towards this. We've already expressed to CMS we would like to have be considered for an extension, but CMS has made clear to every single state they do not plan to issue any exemptions for any state. So we appreciate that they're telling us that up front, but we are going to continue to request an extension, and we are making good faith efforts to get there. But we do think it's a lot being asked of every state in a really short amount of time. The other thing, and this is 2028, so we're not really focused on it right now, but they will also require copays. Our MedQuest program has never required copays of our enrollees. But the OBA law, or HR1, does say that effective October 1st of 2028, so a couple years away, you have to charge a copay anywhere between a penny and $35. Certain emergency, mental health, substance abuse, alcohol use treatments, preventative services are excluded from the copay. That's good news. And also, if you're getting services at our FQHCs or community health centers, also no copay is required. So some of the details that CMS provided in their information bulletin are here. And so I copied this from a CMS slide because I always like to see things direct from the horse's mouth. So this is how they're presenting the work and community engagement requirements for all of us to understand. The overarching thing to think about is they want to see that you've participated for at least 80 hours a month in work, that you've either worked for 80 hours or you've completed at least 80 hours of community service or participated in a work program for 80 hours, or that you're enrolled as a student for at least half time in a program. If any of these things are true, you've met the work and community engagement requirements and you're good to go and you can keep your Medicaid. The other thing is they're saying any combination of these activities that add up to 80. So say you worked 40 hours and you volunteered for 40 hours. That meets the requirement because it adds up to 80. They're still kind of puzzling through, CMS, puzzling through what it looks like if you're enrolled, maybe not half-time, but maybe you're taking a class and you volunteer. How many hours does the class count for? So those are some of the finer details that CMS is still working out. This next column, this is the one I'm really holding a lot of hope out for. I think this is going to help us a lot. This is saying if you don't do the work, all of that, but if you have a monthly income that's not less than what they do, basically, I'll cut to the chase, $580 a month. And the way they get to that figure is federal minimum wage, which is $7.25, if you can believe that. That's federal minimum wage times 80 hours equals $580. So if you can demonstrate that you earn $580 a month, then you also meet the requirements and you don't have to worry about this. And they have a special thing for seasonal workers to kind of average that out across the board. What I want to say is when you're newly applying, we will look at just the previous month of your application, not the current month in which you apply. So we're sitting here in March. If someone's applying in March, then we will look at February to see if you met the muster in February. If not, you're not going to be eligible when you're newly applying. When you're renewing, however, we are allowed to look at all of the past 6 months. Since this population is renewing every 6 months, we're saying if you met this requirement in any one of the past 6 months, then you're good to go. You don't have to meet it every month for 6 months. So in other words, if you had an income of $580 for any one of the preceding 6 months, then you will be good to go. You'll be able to keep your MedQuest coverage. All right. And some of the people that are excluded, they're not going to have to worry about the work and community engagement requirements, are former foster youth up to age 26. So that's good to know. Anyone covered by being an American Indian or Alaska Native, parent, guardian, caretaker, relative or a family caregiver of a dependent child who is 13 years of age and under, or of a disabled individual. So if you're a parent caretaker relative of a disabled individual, you won't be additionally required to meet these work requirements. And if you are a veteran with a disability rated as total, you will not be expected to meet these requirements. Also, and this is something all the states are grappling with, an individual who's considered medically frail. And so there are many ways that states are thinking about how to define that. And most of us are looking at different billing codes that might indicate medical fragility. But the point of it is, if you're medically frail, then CMS recognizes you shouldn't be held to these work requirements. Also, if you are blind or disabled, you are not held to these requirements. And if you have a substance use disorder or a disabling mental disorder with a physical, intellectual, or developmental disability that significantly impairs your ability to perform one or more of the activities of daily living, you will not have to meet these requirements. If you are already compliant, because SNAP and TANF will also have requirements, if you're already meeting the work requirements there, you don't additionally have to meet them for Medicaid. If you're a participant in a drug addiction or alcohol treatment or rehab program, then you don't also have to do this. Also, if you're an inmate, this doesn't, you won't, obviously you're not expected to meet these requirements. And if you're pregnant or during your postpartum medical assistance period, for us, we have a 12-month postpartum period. So pregnant or 12 months postpartum, you're not expected to meet the work requirements. Again, you're accepted from these if you're under 19. So this does not apply to our keiki. If you are entitled to or enrolled in benefits under Medicare Part A, Medicare Part B, this doesn't apply to you. You don't have to do work requirements. Or if you're in a mandatory categorically needy eligibility group, and that's a mouthful. And if you're in that group, you know it. You're also not expected to meet the work requirements. And then if you're just being released from incarceration, you have good 3 months post-release before these work requirements apply to you. Short-term hardship, also there's space for, if any of these happen in all or part of a month, then you're not expected to meet these requirements during that month. So if you were hospitalized or in a nursing facility or an intermediate care facility, if there's an emergency or disaster declared in the area where you live, or if the area you live has an unemployment rate that is above of 8% unemployment. So thankfully for us, the state of Hawaii has one of the lowest unemployment rates in the nation. That's a good thing. So this will not apply for us. And we'll hope that that continues to be true. Also, if you have to travel or your dependent has to travel outside of where you live for an extended time to receive medical services to treat a serious illness, these work requirements won't apply to you. You'll see this acronym, WFTC. So we've been calling it HR1. Some people call it OBA or the Big Beautiful Bill Act. It's all the same thing, but this is the Health and Human Services rebranding. But I just want you to know it's not anything different. They're just calling it the Working Family Tax Cut legislation. So they're changing the name from HR1 or OBA to WFTC, Working Family Tax Cut. All states are prohibited from using our managed care plans to help identify when people are meeting these community engagement requirements. That's come up before. We have wonderful health plans. They really want to help. They're not able to stand up for any beneficiary and say, I know they've met these requirements. So that's something we have to know. And then I close this section with this. This is just verbatim directly from CMS, telling all the states, we recognize that implementing this section of the WFTC legislation is significant. It's a significant undertaking for states that will require policy, operational, and system changes. And CMS is currently developing the required interim final rulemaking along with additional guidance on the new requirements. So this is CMS just sharing with all of us. They get that this is hard work. They get that they still need to do some work to get back to us so that we can do the work. So I'm grateful that they at least acknowledge that there's a lot of work to do and that we're depending on them to give us more information. And then this slide, I won't go into detail because it's a very complicated looking slide. The takeaway from this is actually helping identify. We did a lot of modeling. We've done a lot of hard work to try to figure out, all right, by the time 2027 comes, we think maybe we'll have about 371,000 people enrolled based on the existing trend we're down. And then what do we think? So we think, okay, about 58,000 will be in our aged, blind, disabled category. About 149,000 will be in our kids category. And then 45,000 in other adults or other exempted people. So these are the people of the 371. They're all going to be good. No work requirements here. Now we go to the blue people. These are the people who would be subject to work requirements. So we think about 6,000 people are going to have some difficulty potentially based on trends with the fact that we're doing 6-month renewals. We think that about 31,000 of our expansion adults will qualify for some kind of exemption, which leaves us with 81,000 who will have to show that they are meeting the work requirements. So then we go again to the right. Well, let's break down that 81,000. We hope that about 52,000, this is in our high data matching scenario. So you'll see the 81,000 is represented two different ways here. If we're able to do a really good job with our data matching, we think we can automatically renew about 52,000 people and manually verify about 10,000 people. And maybe then that leaves about 19,000 people in the best case scenario that may lose coverage. In a less good scenario where we don't have good data matching opportunities, maybe we can only verify of the 81,000 about 28,000. And then manually, maybe we'll verify about 15,000 more, which could leave up to 38,000 people without access to MedQuest if they're not able to meet those requirements. So that's where we get our range of anywhere between 19,000 to 38,000 people could be at risk of losing access to their Medicaid coverage in 2027. And this just kind of summarizes what I just shared on that previous slide. I also want to just remind people about the Emergency Medical Treatment and Labor Act, EMTALA. This means that anybody, regardless of insurance status or not, can go to any hospital and receive stabilizing and emergent treatment. This is a really good thing. It's good that people can do this, but it's not the way to receive healthcare. It's not ideal. And for hospitals, it can lead to uncompensated care increases. So it's not a good outcome when the only access to healthcare people have is when things get so bad they're in an emergency situation. We're also working hard to remind people that there's a lot going on out there, but we're sitting here in 2026. These changes, other than the immigration changes in October, the rest of the work requirements, they don't start until next year, 2027. We don't want people to be shy in seeking help now. So people who are enrolled, please go to the doctor, pick up your medicines, continue to seek good health care. And then I like to close just with a few pictures of all of our beautiful people that we serve in the community. These are just some photos from outreaches on different islands. These are our incredible outreach team that makes sure they're out there and helping people stay enrolled. And then this is my favorite because You see all of our kupuna lined up here, our keiki. It's really the whole gamut of people. This is our why. This is why we do the work. This is why we care about the work, and care about all of you. So mahalo. I hope I didn't take too long with this presentation. And again, I appreciate the opportunity to share with all of you.
Mahalo to you, Meredith. Really wonderful that you gave us all that information. I think there might be questions. Let me see if there's anything in chat, but if anybody would raise their hand if they have any questions of Meredith, it was very good, comprehensive review of what's happening and what's going to happen in the Medicaid, MedQuest world.
Yeah,
So thank you so much.
my pleasure.
Anyone with questions? So Meredith, I do have one. So if people have questions, are there outreach workers or where do they get information? Because it looks like a lot of changes and it's not immediate. So there's time, but what is your process for those of us online who actually work with the kupuna? I guess maybe most of the kupuna don't have the work requirements, but if in fact they do have some requirements that are new, where do they get that information?
Sure, where you can always come to MedQuest. I'm also available, but I think having opportunities like this to amplify the message, and for each of you now you all have the kuleana of sharing this message with others, so we really believe in that groundswell information sharing. So you can go to our website. Again, I'm always available. We have a healthcare outreach branch that works with multiple different community-based organizations, all of our federally qualified health centers. So if you think about community healthcare workers, these are the people who will be kept up to date with this information, and will be able to share back with community. And if you have other opportunities, you're in part of other groups that would like to have anybody, myself or anyone else from the MedQuest team, come and share more, we're always happy to do that.
Maybe you could put in the chat, the link or the email or phone number, so people will have that
Will
available.
do, absolutely.
And I have Diane Terada has a question. Can you expand about the assisted living benefit and how one qualifies and what facilities participate in the assisted living benefit?
Oh, for the 1115 waiver.
Yeah, 1115.
What I can do, because I know I've already taken up so much time and that is a little detailed. Is it possible, Senator Moriwaki, for me to send you something that you can send to this
Sure.
entire group?
Oh, that'd be great. That would be
Great.
great.
And I'm writing it down for myself right here.
Okay. Any other questions or any follow-up that you'd like Meredith to give us? And she can send it to us and we will send it to all the people in the caucus. And I see Representative Chen has come out of his session. That's good. You folks take so long.
Yeah. I was looking at the clock. I'm like, oh no.
I know. Oh, thank you. I'm glad you're joining us. The Senate goes, for maybe the max an hour. And then you folks take what, 2.5, 3 hours? Okay, so Mary Lou Larson says, is there any impact on seniors in care homes? And I don't know if this is the 1115 waiver.
Not for the HR1. Not for HR1.
Okay. Well, anyone else? Last call. Well, thank you so much, Meredith. Really appreciate your coming and explaining to us all the developments that are going to come down the line, and let us be prepared.
Thank
So,
you. I
mahalo.
really appreciate
one
the
thing,
opportunity.
you might
Yes.
want to talk about the 2 bills that you have before you leave, real quickly. The Medicaid reimbursement one, and then there's another one. You want to
Yeah.
talk about your 2 bills because people online could support you in what's going on.
Thank you. Yeah, we're hoping to be able to
Give the
and
bill
I
number
hope,
if you have it.
oh yeah, I will make sure I put that in there. Oh, I will get it in there after I do a little brief. But so there are a bunch of bills moving. One of the things we're trying to do is, in recognition of the need for our workers, our care workers, to be able to be paid a little more for the very important work they do. The legislature was so kind and generous in providing an increase in rates, funding the a rate increase last time around, and that was very, very helpful. And we are back here again saying, hey, could we fund it at the medium level now? We had started at the low level and really pushing up towards medium level. So and again, I'll go back after I stop talking and I'll go pull up the bill number
Put it in the
and get
chat
that.
and then people will know, because I
I
think
will.
that's important. Because we
Yeah,
don't want to lose our community-based services.
yeah.
And we may be losing it because the reimbursement rate is low.
Yeah, yeah. It's really important to stabilize the workforce so that there are people that can continue to serve in these important ways. And then additionally, we do have a emergency appropriation bill out there that importantly includes some funding to help restore funding that was sort of advanced during the federal shutdown to make
Mm.
sure people were able to have access to food. During that
Mm.
period of time, you'll all remember it was quite scary for a lot of families during federal shutdown where they weren't going to have access to SNAP benefits or any sources of help with food. So there was money advanced, and so this is part of the emergency appropriation is saying, hey, could we get that funding restored now because we need it for our regular program. And then also there's a portion in that same emergency appropriation bill requesting money to support people who receive their health insurance through the federal marketplace. You guys will remember part of the shutdown had to do with the fact that those expanded tax credits didn't get extended beyond December of last year, which left the premiums that our people are having to pay without that kind of extra bump in subsidy. So there's 16.5 million being requested to help with premium subsidies for folks who do get their insurance through the marketplace. And the reason that's so important is because we know that if people can't afford to pay their monthly premium, they will become uninsured. And then that leads to that whole degradation in the entire healthcare system where people are now without insurance. They wait until things get really bad. They try to not seek care. And then by the time they're in the emergency room, disease has progressed much further than it would have had to had the person had access to coverage. So I'll put those bill numbers in the chat. There are other bills moving around too that we're watching, that we're supporting, and thank you all for being just active advocates, especially for our precious kupuna.
Okay, thank you very much, Meredith.
Thank you.
Okay, we just have our status of bills. I'm going to turn it over to Representative Chun, who did the heavy lifting on our Kupuna package. We've got some other bills, but I want him to go first on all of the bills and resolutions that we have. Thanks to Representative Chun.
Oh yeah, so I think this is the first time that all the Kupuna Caucus package bills are still moving. So
Yay, thanks to
that's
you.
that's awesome. Yeah. So I think the last one, the dementia one, just got voted out just like an hour ago, or maybe 2 hours ago. So yeah, all five House bills are cleared the House and are moving over to the Senate. And I think the rent supplement is coming over from, or should be coming over from the Senate. It's going to get voted on third reading, right, next week. So we're in good shape. Everything's moving. So
And then you want to talk about the resolutions? You drafted the resolutions as well. These we're not sure about, but can try. Yeah.
yeah, so I'm kind of waiting. So the resolution deadline is next week, Friday. And so I don't think I mean, committees can start hearing resos, but I know for like my committee, we're gonna wait for all of the resolutions to the filing deadline passes and then kind of review that. And I think a lot of committee chairs are doing the same thing. So we'll probably check in later on after the deadline with those chairs to see about the resolutions.
Which is next week, Friday, yeah. Next week, Friday.
Yeah, but they've already been introduced and should be referred. Yeah, they're already referred. So it's just, or maybe the House ones haven't been yet. Yeah.
Okay. Well, yeah, there's time. I think we all wanted our bills to get through first. And that was a mad scramble.
Yeah.
So now we have some time to work on resos and getting them through.
Yeah, and there are a bunch of other ones that I know some folks have presented on and were considered part of the package and are still moving too. So like the long-term care financing one.
Yeah, so they're here on the screen share. We added those in. So the long-term care financing one is passing, or I guess is passed out of House, right? You folks got through right
So
there.
that one's gonna be moving over.
The Hanai Memory Network as well. These are all House bills.
Yeah.
The crypto kiosk ban.
Yeah, we just voted on that one again like a couple hours ago. So that
yeah.
coming over.
Okay, and then the Medicaid, the one that Meredith was talking about, community-based services, that one passed out of WAM, so it'll be passed in third reading. So that would be coming over to the House. So this we're in really good shape so far, half time.
Yeah.
So any questions, anyone? Okay, seeing nothing in the chat, no hands up.
Kupuna Aloha is moving, seems like.
That's wait,
good.
we missed that on this list. We have to add it on. What's the number for that, chat?
Kupuna Aloha, let me find it.
We'll add that to our list to follow.
Yeah.
It's on row 3, HB 1973.
1973, yeah.
HB 1973?
Second one.
Okay.
Yeah, there you go. That's it.
Yeah.
Okay.
Thank
So
you.
Alex can add that to our list. Anything else we missed on this list? We should be following. So please support it, even if it's not in the package. We'd like to see these bills pass if possible. Okay. If there is no other business, the next, Alex, who's going to be at the next Kupuna Caucus meeting, which will be April 10th? Do we have anybody scheduled, Alex?
Yes, Senator, we have Cecilia Fong from the Home Care Association of America Hawaii chapter.
Okay, so here from Home Care Association. Okay, and if anybody else wants to present, please let us know, let Alex know, and then we can schedule you for presentations. But I want to thank Meredith and for all that information on MedQuest, Medicaid today. Okay, so I think we're done. Representative Chun, you have anything to add before we leave?
No, I just want to thank everybody for all their advocacy on all of the bills, because you can't move it without you folks. So thank you.
Yes, thank you, everybody. Thank you. Okay, aloha and have a great weekend. We'll see you next month.
Okay.
Aloha.
Aloha.
Aloha.